2,222 new COVID infections. That's what's been recorded in Queensland. We'll take you now straight to Brisbane, where health authorities, you can see the Chief Health Officer there providing an update.
8,586 cases active that have been we've seen over the last 2 weeks since opening the borders to the other states of Australia. Trying to relay this message in a balanced manner is actually quite difficult, and it's something that we've all been grappling with in my professional world. If I can just take you back and compare what's happening now with 2020. So to the end of June 2020 in Australia, there were 8,566 COVID cases diagnosed. So about the same number as we've seen in Queensland since the borders opened just over 2 weeks ago. But associated with that 8,566 cases last year were 204 intensive care admissions and 30 deaths. Now, in Queensland so far, we have, since this latest wave, since opening the borders, we have seen no intensive care admissions and there have been no deaths reported. Now, I'm talking to my colleagues in hospitals on a regular basis, and I can say it is likely in the coming days that there will be intensive care admissions. So there definitely are sick patients in hospital. The really big issue, though, and this is the key issue in trying to balance this message, is we're not going to be talking about 8,000 cases in a few weeks. We're going to be talking about tens of thousands of cases. And that's what a pandemic is about, very large numbers of cases. But the good thing is the vaccines are working, and they have been clearly demonstrated to work. And for those people who have not yet received their third dose, particularly the elderly and those who have impaired immunity, it is critical, if you can, to go out and get that third dose of vaccine in the next few weeks, when your time is come. So at the moment it's 5 months after your second dose, but from the 3rd of January it will reduce to 4 months. So in terms of testing, there were 35,179 COVID tests conducted yesterday. Queues have improved a bit, but demand remains high, and I think we are now targeting better the patients, the people that we want to see, those who are more likely to have infections. We have over 1,809 cases receiving care in their homes. There are 103 cases in hospital at the moment, but as I've mentioned previously, it's difficult sometimes to work out what proportion of those are there in hospital because of treatment for actual COVID or symptoms of COVID or other reasons. There are at least 29 receiving treatment for COVID in Queensland hospitals at the moment. In terms of vaccinations, the state clinics started to reopen yesterday, and 11,700 doses of vaccine were given. More than half were boosters, and around 1,000 were first doses. So as of the 27th of January, our vaccine coverage is 90.52% of the 16-plus population having at least one dose, and 86.19% of the 16-plus population having two doses. Now, as expected, the number of cases of COVID is increasing significantly, and it will continue to increase significantly in the coming weeks. Most people, particularly those of us who have been vaccinated, who have received at least 2 doses of the vaccine, will be relatively well. The illness will be mild in the vast majority of you, and that means you can care for yourself at home. We continue to receive reports of people, as soon as they receive the message that they have COVID-19, calling 000 and calling an ambulance to bring them to the emergency department, or presenting straight up to the emergency department, even if they have just mild symptoms. I must emphasise the majority of us will have mild symptoms if and when we get this infection, because in the next few weeks, all of us will know somebody who has it, and there's a good chance that we may well ourselves get it, and if we've been vaccinated, that illness will be mild. But even if you're vaccinated, there is a significant chance that you will acquire this infection in the coming weeks. So for everyone who has mild symptoms, I want to share with you the first 5 things you should do when you test positive. 1, isolate and tell the people you live with to get tested and quarantined. 2, answer the survey questions a health worker calls or texts you about. 3, tell people you have been in contact with recently to get tested and quarantined. 4, ensure that you have supplies of food and medications and get contactless delivery if you need it. And 5, look after yourself, keep a symptom diary and look after your mental well-being.